Thank you very much, Dr. Prem. And here is some gift for you for your participation. So once again, thank you for coming to Lithuania. O dabar, ponios ir ponai, iki kavos pertraukos mes turim 20 minučių ir galime jas išnaudoti produktyviai. Tai yra trumpai diskusijai su mūsų dviem pagrindiniais pašnekovais. Tai yra su Dr. Prem ir taip pat ponia Stephano. Jeigu turite klausimų, prašau pakelkit ranką ir mes paduosim mikrofoną. Ar jau yra kas nors, galbūt jau nori ką nors ar papildyti, ar paklausti, ar patikslinti. Taip, čia matau ranką, tai jeigu galima, tada tik kiek įmanoma prašysiu glausčiau, kad būtų progos atsakyti mūsų svečiams.
Hello to everyone. I have a question to Ms. Stephano. Could you please briefly describe the CMTP program? Pricing, topics, duration, and etc. Thank you.
The CMTP program is based on 8 to 9 core curriculum modules. If you take the program you could take the program online, so it's available through our website, and it takes approximately 8 to 9 hours to complete. There's a workbook that's attached with it in addition to the PowerPoint slides. The focus of the program is, one, understanding the global market, also understanding the role of facilitation, looking at the expectations of a traveling patient versus perhaps a local patient or a typical tourist, looking at risk mitigation, the important use of technology, marketing medical tourism, and in the end, the goal is that you have a CMTP certification by taking an examination. It's a 2-year certification, which gives you also individual membership to the association, which has a whole list of benefits as well in terms of discounts for events, access to market research and information. We also have for facilitation companies startup kits.
Thank you for your answer. Also, I would like maybe to ask you to expand on the one point, Ms. Stephano, that you mentioned in your presentation about telehealth and digital second opinions. As a lot of businesses are going digital right now at the moment and most likely in the future, can you expand on the possibilities that Lithuanian health tourism might have in this field?
So right now, most of the emerging markets are looking to develop telehealth centers that connect their rural communities with their urban communities. And so they do look for partners to provide second opinions and also remote diagnosis. And the idea behind these telehealth centers is that then the patients from rural communities don't necessarily need to travel. They perhaps can get diagnosis working with local physicians. And then the urban centers that are connected to that system can work with referring physicians. They can work with other hospitals to provide those second opinions and diagnosis. So for instance, Lithuania could create tie-ups with some of the emerging markets where it may be unlikely or unreasonable for a patient to travel, or maybe unnecessary for a patient to travel. They could provide a remote diagnosis, they could provide a second opinion confirming diagnosis, and also serve what we call a triage relationship. So determining that perhaps the patient doesn't need to travel at all, the local physician could handle that. What that builds is brand awareness. It also creates trust and confidence in the quality of services that the Lithuanian providers have to offer. And then of course, in the event that that case needs to have higher specialized care, those patients could then be referred because the trust has already been established.
Is it already an established market in the world, or Lithuania or could be like emerge as one of the front runners if we have a political wish and willingness to go digital?
Medical second opinions is very, very common. So you'll see a lot of the top hospitals in the world already have medical second opinions programs on their websites. With the global patient management system that we built, we've actually integrated second opinions so that any patient from anywhere could access the second opinion from a Lithuanian provider. But I do think in this, particularly in Europe, that type of technology is not prominent, and I do think that Lithuania could come out as a forerunner, as you described, in terms of having a specialized program for triage, second opinions, and telehealth.
Okay, thank you. Any more questions from the audience? Yes, please. Čia, jeigu galima, ponas Tena ir po to ponia priekį.
Hello, everybody. I'm just interested, it's a question for Mr. Prem. What are biggest mistakes you noticed were done at developing medical tourism? You noticed because you have examples of different countries. And and a second question would be, which country you think is now, how to say, star in this field developing? Thank you.
So I got your first question. Second is, which country is the star? It's like the leader. Star. Okay,
yeah.
Fine. Thank you. So Lithuania hasn't done any mistake yet, very honestly, because Lithuania hasn't done much yet. Yes, isn't it? But it's good that you're putting workshop well before you're trying to become a star, and then you're doing this educative event, so that you're trying to learn before you put lots of efforts. Good thing about Lithuania is that I have not seen such cluster activity from any country, very honestly, and we were very happy to see. Yesterday we did workshop, and we were very happy to see the interaction and the interest of some of our participants and the knowledge which they exchange. And it seems that they have great interest, great knowledge, great intentions, which is required in medical tourism, and they are willing to learn and do better things. What I would say to you that it's not the medical tourism only. I think so Lithuanian tourism, entire tourism also, they need to revive their strategy. They need to have boosting, activities. You need to do so many other things to promote Lithuania as a brand. And then also you need to think about medical tourism. When you promote in medical tourism, as I mentioned to you, don't try to press your pedal very hard. Speed limit here is a 60 or 80 miles per hour. So don't try to go for 120 speed. Just aim to focus on certain geography where you can get good patient. Start slowly, start gradually, and put the medical tourism as additional component in your healthcare system. You are doing already good healthcare for your patient. So start highlighting some of the areas, some of, let's say, your cosmetic surgeries, your dental surgery, your cardiology, your neurosurgery. Start promoting those, and start capturing on certain target market for certain services, and try to aim to get just 15 to 20% market. And you have all essential components to do that, except some of the tourism area. Number one. Number two, when you ask me who's the star, actually there is no single star which stands out in the medical tourism. There are many good countries like India, Thailand, Turkey. They have done great in medical tourism, and they are getting very good number of patients. But here is what, you should be feeling more happy that if even you are not ranking on the top, because it is, when I say that Thailand and India and other countries who they are leading in medical tourism, that doesn't mean that they're providing very good healthcare services to their own national population yet. Yes, so pathetic if you see what India provides. India has spent hardly 3% of their GDP on healthcare system. Comparatively, you guys spend 10 to 11%. Thailand also has a very poor healthcare system. So what they have done good in international medical tourism, you can take some concept, but when you promote medical tourism in Lithuania, first focus about your own local requirement. Make sure that your local citizens are happy, they are getting the healthcare services, and then look at what you produce in overcapacity. Do you have more rehabilitation center? Do you have more cosmetic doctors? And just focus on those and selling those services, and you will do wonderful.
Ms. Stephano, would you care to expand or to have a remark?
I think one of the really interesting things about medical tourism destinations is that you can take a little bit from each country and their development process, and you could take away a learning lesson. So in order to build a successful destination, you have to look at the strategy, you have to develop, and then you promote. And you could do some promotion along the way. So many destinations have done one or the other, or have done two, or maybe not all three. So South Korea, I think, is interesting. And to Dr. Prem's point about focusing on local healthcare needs, in 2008, South Korea did not have a national accreditation system. They used medical tourism as an incentive to build it, because they knew all the local hospitals, public and private, would benefit from building that accreditation scheme. And some of the hospitals, of the 32 that are in the cluster, additionally got Joint Commission International accreditation on top of that level. But they knew right away that the ability to communicate quality was important, and that their local population would benefit from them. They had a strategy for medical tourism, but for instance, part of their strategy was to open up a regional office in Abu Dhabi. They wanted to attract the Middle Eastern patients, but they never built a market penetration strategy for it. So after several years of being there and not achieving the results, then they stepped back and they did their strategy. So for Lithuania, the feasibility study that was conducted, you understand what the opportunity is. I think a key point now will be to take away some of the pieces that we've shared with you in terms of what is the market penetration strategy going to be? Who are our existing tourists that we can convert into health tourists, and who are our regional markets that we can attract for medical tourism as well, and also be promoting along the way. But I think a key is that service development, looking at healthcare quality and looking at customer experience and how you can really develop and perfect that, because that's going to, again, help the local population as well.
Thank you very much. Čia mačiau klausimas.
I want to put such a naive question to you. We are in tourism business for more than 20 years. I run a not big tourism company, and for so long period, so we hear one and the same problem. That we need a promotion of Lithuania as tourism destination. We have very good potential as cultural tourism country. Now as a medical tourism country, we also have some advantages, and we know also our disadvantages. I would like you, as top tourism experts and authorities in the world, to name, from your point of view, who is to take the initiative here to push the situation in Lithuania so that we would be in a bit more better position, you know. We would be more better positioned in the world as a tourism destination. Thank you.
Thank you.
Thank you for such a wonderful question, and I appreciate asking this question, and I think so this would be probably on behalf of everyone sitting over here, and if not all of you, it's on behalf of many visitors like me who are coming over here and seeing Lithuania has almost everything. It's so hard to choose whether I want to sit in a wine bar, or I want to go for ballooning, or I just want to see architecture. It's such an amazing tourist country, and yet you do not have enough tourists. So I think so major problem lies with probably your tourism strategies through tourism board, and I do not want to pinpoint as such any specific. I'm sure that they are qualified enough and they must have done all the study. Couple of things which came in my mind. Renée had a difficulty to reach over here. I had a difficulty to reach over here, and the very poor airline connections over here. And there is very little information about Lithuania. As I mentioned, that many of my friends, they do not know where this country is and probably what they are offering and what they have good things. So you all need to participate in more international activities, more international conferences, and you have to start meeting with more tourism organization, tourism board, and probably develop some more strategies to invite more tourists in the country. start putting up things which you are doing good and start highlighting those, and this could be done on national level as well as on individual level. For example, you said that you are running a company, so you don't necessarily need to wait for tourism board to do things. They will do it when they want to do it, but you can go ahead and go put your services on TripAdvisor, put up a nice Facebook page, put lots of social media activity and do your part, right? It is just about doing few things from your side which will create the awareness. I think so what is required right now, awareness to external world that what you are doing good, and eventually more tourists will be coming over here. It is extremely important to understand this thing, please, that when you try to promote medical tourism, you're not going to get new stream of the patient or new, altogether you're not going to get patient from Africa or the countries from where the people are already not visiting here. If you are getting more CIS people visiting here, more Nordic people visiting here, you will only see that you can convert them into medical tourists. The idea should be that if a tourist coming to Lithuania and is spending $1,000, find a way that how can you convince him to spend $2,000? Just what Singapore did. Singapore didn't go crazily in all countries and started promoting medical tourism. They just promoted people who were coming to Singapore. They had a boarding on airport, they had activities on the airport, and they got huge amount of business. So I think so you can do small strategies. You don't necessarily need to invest millions of dollars in marketing and promotion, but if you do bit part from all of you, hospitals can do, medical tourism facilitator can do, and all the bar and restaurant activities organization can do a bit part.
Mr. Stephano, do you have something to add?
I'll give another side of that as well, because there are some destinations that have done well in getting government support for some of these activities as well. But it always needs to be public-private cooperation, meaning get government support of programs without private sector investment and involvement isn't sustainable either. So Turkey, for instance, they established a medical tourism law where if you go to an international conference for health tourism, you can get 50 to 75% of your expenses as reimbursement. Because they have a strategy, they see health tourism as economically viable, they have goals that they want to achieve. The tourism, the Ministry of Tourism has an integrated promotion of health tourism. They're responsible for the spas and the thalassos, so they've tied wellness with the medical services together. And the Ministry of Health right now is looking at developing training and certification to improve capacity for delivering international patient services. So there's an example of collaboration, but there, in the private sector, there are medical tourism associations all over Turkey. So there's one in Izmir and Bursa and Istanbul, and so they too are individually invested in creating that visibility and opportunities as well. So it truly, something like that I think gives you a good example of how policy could be developed to support it, but also the need to have the private sector commitment, both financially and also in terms of effort.
Thank you very much. Also a question to both of you, maybe also to expand on both your presentations when you mentioned the importance of social media, importance of communication. But I think in this country and in a lot of other countries, we have a problem with the lack of communication skills in governmental level, in business level, especially in new media and social media. So if you are a doctor or a medical company or a tour company, you do well what you do in your business. How would you try to help them? How would you explain the need to communicate? What should they do in order to use the advantages of social media, of a million contacts, or building a brand new digital websites and so on, when they don't have an idea how to do that on sustainable level, not on just
this is again excellent question because social media, probably we are talking here as a platform, but yesterday in workshop we discussed that social media is modern way of word of mouth marketing. Just like 50 years and 100 years back when there was no newspaper, no television, no radio, how marketing used to work. People used to get together and talk about their good experiences and bad experiences. And this is how previous generation used to get the idea that what is a good services, which is a good country to travel and all. Today, that word of mouth marketing has been further enhanced by social media. So I am able to write where I am traveling. My friends are able to see that and they are able to write it back to me and communicate back to me. So social media is an amazing platform for word of mouth marketing and exchanging knowledge. It is not necessarily you should take it as a promotion tool. Now here is the difference. I have seen many companies, many organizations go to social media and just vomit. What's a vomit? They just go and throw everything they have, all the pages, services, they put it, all the pictures, everything. But it is not about promotion or advertisement. It is about letting people know about your emotions and involving with people, communicating with people about your emotion, how you're feeling, how you are finding the activity, some information for them. They don't want to see on social media your promotion or advertisement. They have enough of the advertisement and promotion from the TVs and internet channel. So the idea is to find out what message you want to give on social media and then keep that message emotional or something that is going to help other person. It could be knowledge, it could be happy feeling, it could be the way they can use in their daily life or in long-term strategy. And this has been a great strategy for us because we've been using social media ever since from last few years, and we have huge amount of followers, we must say that. So if you are a hospital and medical facility clinic, go to your social media page and see what is interesting in your industry, not necessarily what your hospital is doing. You don't necessarily need to talk about what you're doing. Don't vomit on social media, please. Talk about sensible things from your industry, from your organization, which will be interesting for people to listen and then build a good community around your page, good people coming back on your page to get that interesting information, not just the promotion.
Stephano?
Well, I completely agree. I think that we have to use social media as a way to engage and also to communicate patient stories, things that people want to hear about, success stories, and not from a promotional way, but from a heartfelt, you've changed someone's life or you've given them access to something. So for instance, on our Medical Tourism Magazine site, we, one of the values of membership of our organization is that we incorporate them into our articles. And those articles come up on Google Alerts. So we get a lot of feedback from people that they've seen the articles, they think it's great, they can't believe that this clinic has provided this type of care, how wonderful for the child that had the hand transplant, or how wonderful it was for this elderly woman to be able to have the cardiovascular intervention. I never knew that you could get that type of care somewhere. So people read those things from a business to business or business to consumer perspective. If you think about the newspaper, what do we read the most? We read the stories about other people's lives, something happened to somebody else. And this is another use of social media that I think is very effective. I think there would be a great benefit to utilize the cluster's website as a way to keep live information, patient testimonials, patient stories, really telling that patient-centered care that Dr. Prem was referring to, and that might be some way to utilize it better. Okay,
thank you. I think it's a great advice what Dr. Prem gave, and just maybe for some medical institutions it would be, the advice that to go and find out that you don't have a social media page, so you need to create one. So okay, we have time for 1 or 2 questions. Yes, please, the gentleman in the middle. Please wait for a microphone. Yep.
Thank you. Most of us here are probably local providers for tourism and not hospitals here. So my primary question is coming to certification, certifying the services. It's not going to be done on the government level, at least not in the next 5 years, maybe even longer, because you're in a quandrum because doctors are not getting enough paid, they're all leaving the country, then they come back and it's not enough high enough salary. So self-certification, how do you envision that on the local and private sector? I mean, should we just push it ourselves as far as with the cluster? And how long do you think that takes on that private certification before the rest of the cogs of the government start moving? Since you're working in undeveloped countries as it is, Thailand, Korea, I mean, all these moved very slowly. How long did it take?
So in Puerto Rico, for instance, they already had, most of the hospitals had international accreditation, but we're doing some work in Jordan, and some of the hospitals have international accreditation and others don't. They have a local accreditation program, and in that case, we are actually partnering with their national accreditation scheme to, through train the trainer programs, create capacity building and a sustainable model. The other model is like Puerto Rico, where we're coming in and doing all of the training and certification. In the case of Lithuania, you could look at two of those, you could look at both of those as a potential option, where the cluster adopts or licenses international standards for international patient services, and through Train the Trainer program certifies trainers, and those trainers create sustainable training on an ongoing basis. So with the healthcare providers, obviously there's different levels of development. The training can be done as a group training. The certification requires a diagnostic evaluation of each healthcare facility or hospitality or tourism facility. And that's really the most time-consuming part. A hospital may be a full-day diagnostic. From the diagnostic, we evaluate them and we rate them to the standards based on the metrics, and we make recommendations for improvement to either achieve the certification or to improve from whatever score they had to a higher level. Now, for the facilities to then get their survey and acquire it, it's very simple. How far along are they? What policies and protocols do they already have in place? How much work actually needs to be done? These are specifically not patient safety quality standards. These are international patient service standards, which are based on education, communication, transparency, protocols, risk management, and those areas that are soft service. So there's an understanding that the facility has already patient safety and quality certification in place.
Just a short answer, please, because we are running out of time.
Yes. Yes, there was one done.
Okay, one final question before we break. Do we have one more question from the hall? We're good. Okay, so thank you very much again for our presenters. And now we have 20. Yep. We have 20-25 minutes coffee break, and we'll reconvene at 12:30. So please enjoy your coffee and refreshments.